Where do we get water besides from the tap? Well, okay, so 100% of what comes out of the tap, and let's say diet soda, that's 100% water. 90 to 90% berries, milk, lettuce, celery, non-fat milk. 80 to 89% fruit juice, yogurt, apples, oranges, shrimp, bananas, corn, potatoes, even cottage cheese, mostly water. Pasta, cooked pasta, over 50% water. Now, I'm not recommending ice cream as a fluid replacement beverage, but there is a lot of water in ice cream, even ground beef and hot dogs. So, page shows you can get lots of water from a varied diet containing fruits, vegetables, legumes, chicken, salmon, pasta, even ice cream. The electrolytes are minerals that are charged particles. They're salts that dissolve in water and dissociate or break apart into charged particles called ions. Sodium and chloride or salt dissolves into the electrolytes, sodium and chloride, and potassium is also an electrolyte. They function in helping to maintain fluid and water balance as well as acid-base balance. Potassium is the major intracellular electrolyte. It's found mostly inside the cells. Sodium and chloride are mostly outside the cells. So let's look at this diagram again. Our cells, the fluid inside the cell is rich in potassium. Potassium is the major intracellular electrolyte. The major extracellular electrolytes in the fluid outside the cell are sodium and chloride. If you've ever bitten your lip and it tasted salty, that's the sodium chloride in the blood. Drinking water and eating regular food will help restore fluid and electrolyte balance. With excessive sweating, bleeding, vomiting, or diarrhea, special drinks may be used to restore electrolytes. We're talking about extreme cases. Where does the sodium in our diet come from? Most of the sodium in our diet does not come from the salt shaker, although I do understand there are people out there who like to salt their food before they eat it, but it comes from processing of foods. Let's compare a baked potato to potato chips. Big difference in sodium. An apple to apple pie. Beef to lunch meat, or cucumbers to pickles. The more processed the food, the higher the amount of sodium found in it. I'm not telling you never to eat pickles or, well, I don't know about lunch meat, but pickles or apple pie or potato chips, but I want you to be aware that they are a source of sodium. Sodium is an excellent preservative. Foods that are going to be on the shelf for a while are going to contain sodium. We also have developed a taste for sodium. You just have to watch the amount. Remember, folks, it's the dose that makes the poison. Adequate fluid intake is important for health and optimal functioning. Dehydration has negative health effects. Overhydration also has negative health effects. And the electrolytes, sodium, potassium, and chloride, function to regulate fluid and acid-base balance. The final topic will be major minerals in bone health and iron. We'll look at deficiencies, toxicities, functions, and food sources of the bone minerals calcium and phosphorus. We'll talk about osteoporosis and the risk factors, and we'll also look at iron. We have calcium in our bones, and we also have calcium in our body fluids. Most of the calcium in our body, 99%, is found in the bones. That remaining 1% is found in our blood, but that 1% has many, many essential functions. The bone and blood calcium are kept in a balance with a system of hormones and vitamin D, but the blood calcium will remain in balance at the expense of bone calcium and the risk of developing osteoporosis in later years. In other words, that 1% of calcium that's found in our blood is so important, the bone will sacrifice its calcium in order to maintain blood calcium levels. And some of these important functions include muscle contraction, heartbeat, nerve impulse transmission, blood clotting, Calcium is involved in all of these reactions that go on in our body, and in the absence of calcium, we could die. Therefore, the calcium in our bones will be sacrificed in order to maintain blood calcium levels. With adequate calcium intake, blood calcium will remain normal, and our bones will deposit calcium, which will lead to the development of strong, dense bones. In other words, a good diet with adequate nutrient intake will give us normal levels of blood calcium and strong, healthy bones. But with a poor diet, you should notice that the blood levels, these little red dots represent calcium, still remain the same at the expense of the bone giving up its calcium, resulting in weak osteoporotic bones. Again, that 1% of blood calcium is so important that the bones will be sacrificed. Bone calcium will be sacrificed in order to maintain that 1% blood calcium. Dairy products are a good source of calcium, but we can also get calcium from non-dairy sources like fortified beverages, cereals, canned fish with the bones. Okay, so here I'm talking about canned salmon, and yes, I'm talking about the bones that are found in canned salmon. That's where the calcium comes from. So if you have canned salmon and make salmon salad, you're supposed to keep the bones if you're looking at it for a good source of calcium. Also spinach, turnip greens, tofu, you guys can read that. Of dairy sources of calcium, this is cocktail chatter. And here's the calcium in non-dairy foods. A lot of people take calcium supplements because they don't get adequate dietary calcium. First of all, I want to tell you that, of course, I recommend food sources of calcium because it's more available to the body for use. When you drink milk, you not only get calcium, but you get lactose, you get vitamin D and magnesium in order to help absorb the calcium more effectively. Whereas when you're taking a calcium supplement, all you're getting is calcium. That being said, if you aren't going to get adequate dietary calcium, then maybe a calcium supplement is something that you should take in your diet. Because over time, in the absence of dietary calcium, in the absence of strengthening of bones and other nutrients that are important for bone health, you can develop osteoporosis, the silent bone stalker. The table lists two types of osteoporosis: postmenopausal, well, what I'm calling elderly, because the book referred to type 2 osteoporosis as senile, and I hated that. So I changed it to elderly. The onset for type 1 osteoporosis between 50 and 70 years, type 2 over 70. The bone loss, where the bone loss comes from, is different between type 1 and type 2, and that's what we're going to look at. Men are at a much lower risk of developing type 1 osteoporosis, but they can develop type 1 osteoporosis. The fracture site is different between type 1 and type 2, and the causes are somewhat different. In women, type 1 osteoporosis is associated with estrogen loss. As men age, testosterone levels decrease, and they also have an increased risk for osteoporosis. In type 2 osteoporosis, there's a reduced absorption, there's increased loss or demineralization of calcium from the bone, but also depending on the person's situation, if they're ill, if they're bedbound, if they're on a lot of medications, there may be an increased risk for falling. This is a picture of the hip bone, the trabecular bone, and the cortical bone, the bone on the outside, that hard outer shell. The trabecular bone is the lacy inner structure in which calcium crystals are deposited that support the bone structure and provide a calcium storage bank, which we'll talk about in a few minutes. The cortical bone is that dense bone tissue that forms the outer shell surrounding the trabecular bone and comprises the shaft of a long bone. So it's this outer strong portion of the bone. Bones are made of two types of cells. Well, they're probably made of more, but for our purposes, osteoblasts and osteoclasts are the cells that make bones. Osteo is a prefix for bone. Osteoblasts are the bone-forming cells. They're the ones that deposit minerals and proteins in the bone for maintenance, growth, and repair. I remember osteoblasts as builders because they both contain B. So if that helps you, use it. If it doesn't, forget I ever said it. Osteoclasts are the ones that break down old bone to make way for new bone and help maintain blood calcium levels. In other words, if your blood calcium levels start to drop, the osteoclastic activity will increase in order to break down bone and release calcium to maintain blood calcium levels. Bone mass is gained during the first 25 to 30 years of life. This would be a period when osteoblastic activity outpaces osteoclastic activity. We then have a period of maintenance or stabilization for around 15 years until about age 40. The exact age depends on the individual, when osteoblastic activity is pretty much equal to osteoclastic activity. Then after a woman goes through menopause, there's a decrease in production of vitamin D, a decrease in absorption and metabolism of calcium and vitamin D. There is a decrease in estrogen production after menopause, and the woman begins to lose bone calcium. We see two different graphs on the right, one in which the woman is not losing bone density or as much bone density and is able to maintain much of her height. In the lower picture, the woman is losing much more density in her bone. She's starting to develop a curvature of the spine because the amount of calcium is being lost, a compression of the vertebrae in her spine, increasing the risk of fracture. At the bottom, on the right, we see what porous bone looks like. That's where osteoporosis comes from. Porous bone cells. On the left are healthy bone cells. This is to remind me to give you my bone bank, my calcium bank analogy. So think of your bones as a calcium bank. During the first 25 to 30 years of your life, you can deposit into that bone bank. And then, depending on whether you have a lot of calcium in your deposit, in your savings account, well, yeah, let's talk about this as like an interest-bearing savings account. And depending on how much you put into your savings account as you age, when you go through menopause or when men stop producing as much testosterone and start drawing on their calcium bank, depending on how much you had in it when you reach that stage in your life, if you're drawing on the interest, let's go back and look at our woman in the previous slide. You'll be the woman on the right, but if you are drawing on the principal, you will be drawing on bone density, you will be losing bone, and you are at much greater risk for osteoporosis. So that's why you should think of your bones as a calcium bank. You may not be able to notice any benefit of your account right now, but when you reach a stage in your life when you need to start drawing on that account, you want to be drawing on the interest and maintaining your height and bone density, not drawing on the principal and losing height and bone density. There are a number of different types of fractures that can occur with osteoporosis. The wrist fractures are the least severe. They mostly occur around age 50 or older and may be an early warning sign of osteoporosis. Or it may mean, like for my friend, that she fell off her bike and tried to break her fall and wound up fracturing her wrist. Spinal vertebrae, these are more likely to occur between 55 and 75, and they're fractures that may occur from bending or lifting. What's been happening is that over time, as the bone has lost calcium, as it's decreased its density, there is an event that occurs that leads to the fracture in one of the spinal vertebrae. Several fractures can lead to the loss of height and curvature of the spine. As those vertebrae start to compress, it leads to spinal curvature, and fractures can also accelerate that. Chronic back pain can be a symptom of osteoporosis. However, it can also be a sign of aging. So if you have chronic back pain, don't think that at your stage you have osteoporosis. There are a lot of different things that cause back pain, but osteoporosis of the spine is one of those things. The hip fracture is the most serious, and these are what occur in elderly folks. This would be probably where the Elderly osteoporosis would fall under that category. Many folks who have hip fractures at this age in their life may die. Up to 20% can die within 4 months. Up to 50% may ultimately need long-term care because recovery from hip fracture can take a long time. And when you're bedridden for a long period of time, other changes can occur in the body that may make it more difficult to take care of yourself. Risk factors Risk factors for osteoporosis include low calcium diet, also a diet that's low in vitamin D, magnesium, and fluoride, family history, small frame size, so picking the wrong parents can be a risk factor, lack of exercise, particularly weight-bearing exercise, because weight-bearing exercise stimulates those bone-building cells, smoking and alcohol, and menopause due to the changes in hormone levels that are related to helping to maintain bone density. When estrogen levels decrease, they can lead to a change in the relationship between the osteoblasts and the osteoclasts, and they're associated with increased osteoclastic activity, which increases bone loss. Now we're going to look at minerals. This is my periodic table of dessert because, of course, I have a periodic table of dessert, because doesn't everybody? But the arrows are pointing to the different trace minerals, but the one in red is iron, and that's the one that we're going to be looking at. We have different forms of iron, which we'll look at in a minute, but it's a component of hemoglobin. Hemoglobin is a protein in red blood cells that transports oxygen in the blood. Myoglobin is the protein in muscle cells that helps make oxygen available for the muscle. Iron is also a part of many other proteins and enzymes. Anemia is a deficiency Anemia is a deficiency condition associated, by deficiency of a number of different things. Anemia can be caused by a shortage or abnormality of red blood cells. This compromises the delivery of oxygen throughout the body, and different nutrients, deficiencies of different nutrients can lead to anemia. The one we're going to talk about briefly is iron deficiency anemia, but deficiencies of vitamin E, vitamin B12, folate, and other nutrients can cause anemias. So an inadequate intake of these nutrients can lead to anemia. Signs and symptoms of anemia include muscular weakness, tiredness, fatigue. You can see the symptoms here. But again, you can have some of these symptoms. It doesn't mean that you have iron deficiency anemia or any other kind of anemia. But certainly if they persist, it's something that you can talk to your doctor about when you have your next physical. Oftentimes, a deficiency can be diagnosed pretty quickly with a blood test called a hematocrit. This test involves taking a small amount of blood. This is a tube of blood, of whole blood, and then you put it in a centrifuge and spin it down, and you separate the red blood cells, the packed red blood cells, from the plasma. The plasma or serum layer is what's on the top. We briefly talked about plasma in previous lectures. Plasma is the part of the blood that our sweat comes from. When you are losing heat from the body, when your internal body temperature builds up and your body gets rid of it, it's transported to the skin and you lose it through sweat, and the fluid is coming from the plasma portion of your blood. But when a hematocrit is being measured, you look at the percentage of plasma to the percentage of red blood cells. And in this case, the person has a hematocrit of about 50%. So 50% of this tube is packed red blood cells, and that would be considered a normal range. So a hematocrit is a blood test that looks at iron levels, because iron is found in the red blood cells, in the hemoglobin of the red blood cells. Sources of iron come from heme and non-heme sources. Heme iron, which is about 10 to 20% of the heme iron found in animal products, is absorbed. About 2 to 5% of non-heme iron is absorbed. So you can see, so this should show you that heme iron is more bioavailable or biologically available for the body to use. It doesn't mean that you can't maintain iron status from non-heme iron, that vegans can't get adequate dietary iron from non-animal sources, but it is one of those conditions, iron deficiency anemia, that vegans are at a higher risk of developing. I want to explain to you a little bit more about the difference between heme and non-heme iron. As I said, heme iron only comes from animal products. This is an example of, I don't know, a hunk of meat, but it contains both heme and non-heme iron. But on the bottom with our, I guess these are heads of broccoli, you only get non-heme iron from vegetable sources. There's no heme iron found in vegetable sources. I had this little note to myself because if we were in the class, I would be writing on the board the difference between ferric and ferrous iron and the importance of vitamin C. But we're not there, we're here. And this is what I'm going to try to do to explain to you the importance of the different types of iron. So iron can be found in different ionic states. I'm not asking you to remember the chemistry, but we have ferric iron that comes from non-heme sources or non-animal sources. And we have ferrous iron, which comes from animal sources. What I want you to notice is that one is a +3 and one is a +2. Generally, that's not something you need to remember, but in this case, what you need to know is that it's the ferrous iron found from animal sources that is more bioavailable or biologically available to the body and can help improve iron stores or maintain iron stores. This ferrous iron is what's difficult for vegans to get because they don't eat animal foods. However, when you add vitamin C to a non-heme source of iron, it changes the chemistry of the iron from ferric to ferrous, and it improves the bioavailability of that nutrient. So for vegans who are getting their iron from these non-animal sources, it's a good idea to try to consume them with a source of vitamin C to change the chemistry of it to make it more absorbable or bioavailable. So you should know the difference between ferric and ferrous in that vitamin C helps to make non-heme iron more available. Some food sources of iron. Hereditary hemochromatosis. This is a genetic disorder that affects people from Mediterranean descent, but can also affect others. It's a genetic order that results from a defective iron transport system. The proteins that transport iron in the blood don't work as well. They don't get the iron out of the blood, and what happens is there's an increased absorption of iron from the intestine and high iron levels in the blood. Interestingly, the treatment for hereditary hemochromatosis, well, a low iron diet. However, donating blood is one thing that a person can do to treat hereditary hemochromatosis. Giving blood every 6 weeks or so can help lower iron levels. I thought that was kind of cool. So hereditary hemochromatosis, a genetic disorder resulting in defective iron transport proteins causing an increased level of iron in the blood. In summary, we talked about calcium and phosphorus, how they're important for bone and tooth. They do have other functions in the body, but we primarily focused on bone, discussed type 1 and type 2 osteoporosis. We also looked at iron and its component in hemoglobin and the development of iron deficiency anemia, as well as the difference between heme and non-heme iron. Briefly looked at hereditary hemochromatosis and a couple food sources of these nutrients. All right, see you later.